Good afternoon. I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, April 17th, and I'm here today with Ed Brubaker for another one of our Friday chats. Nice to see you.
Good to see you, Alex.
So this has been an interesting week for us. We really have had our cases of coronavirus come to Living Branches. We have now cases in Harmony House. And so we've been getting a lot of questions from our viewers, asking many more specific questions about what's happening with coronavirus at Living Branches. So our first question today comes from Donna, and she says, what is the protocol if a resident comes down with COVID? What does that look like?
Yeah, that's a good question, Alex. And really the protocol is different depending on what level of care a person is in. The first protocol would be is they need to be quarantined and they need to be separated for typically around 14 days. But that would be done differently in different levels of care. If the person is in residential living by themselves or with a spouse, that's going to look different than if they're in personal care or if they're in health care. But the main thing is quarantining them away from other people. You may have seen Chris Cuomo in his basement and interviewing his brother Andrew, but the idea is to separate yourself from others that you might come in contact with. If you live in a spouse, certainly it's advantageous if you have a 2-bedroom apartment that you can stay in the 1 bedroom and really literally get your food through the door and be quarantined in that area. I know my wife and I have even talked about it, like what if one of us got it? What would be the ideal place in our home? And we determined it was probably the master bedroom because it has a bathroom off of it. It's a decent size, etc., as opposed to the basement where there isn't a bathroom down there. It's not fully doghouse basement. It is nicer than that. But the point is it doesn't have a bathroom. And so those are the kinds of things to think about, that you want to be able to be separate from others. Within personal care or within health care, that means within your room. And so persons in those levels of care, we would work to keep them within their room, their living accommodation.
Another question that we have, this one is from Kim, and this is an interesting question. She's asking us, your communities have been on lockdown for a month. I haven't been able to visit my relatives. So if coronavirus comes in, it's probably from a staff member. What are you doing to identify and quarantine those people?
Yes, and that's another good question, and it's a very legitimate question, because in some ways I think it can feel that when we eliminated visitors, that's how somehow put a cloud of protection over Living Branches campuses. And the reality is it didn't. What it really did was reduce the exposure. That's really what it did. It did not eliminate the exposure, and it did not change that persons still could get the COVID virus. The challenge is people may be asymptomatic and be spreaders of the disease. And many times that can be more young persons because they typically don't have as many symptoms. Persons who are most vulnerable to this disease, as we understand, are older and also persons with other underlying health conditions. So that's the reality. It was never intended to be an elimination. It was a reduction of the outside exposure. We can control, if you will, the staff exposure more. We've been masking for a couple weeks now. We've been probably a month now, have been doing the screening checks and the temperature checks. So it's just easier to control, if you will, that smaller population. So that's really what it is all about. I think it can feel like, oh, we're that much safer, and yes, we are, but the risk is far from eliminated. I would also say I just recently read an article that on the ship, the Theodore Roosevelt, I guess it was, the Navy ship, I believe there were 60% of the people that tested COVID positive were asymptomatic. Now that means they were asymptomatic, but they were still spreaders of the disease. So unless you test the entire country, which I believe have only tested a few million out of 300 and some million, so we've just a small dent in that. But unless you test everyone, you really don't know. But even if you did test everyone, you would only know for that date and time. A positive test actually gives you more information because then you know what you can do. A negative test does not mean you aren't going to get it tomorrow. It just means today, the day of the test, that you didn't have symptoms for it. So that's the challenge. It's very, very difficult to manage and control. So the idea of visitors, and I totally and completely understand the challenge of families not being able to see their loved ones. I mean, that is just so sad. In fact, I read an email this morning from a CEO at a facility in Lancaster, found out that her mother just contracted COVID and her father had symptoms, and so they were thinking he might be. But she can't visit either, right? So we're all experiencing this disease, and it's very, very sad. But the reality of reducing visitors was more about reducing the number of exposures as opposed to suggesting that all was okay and there would be no exposure from then on.
That's a really good point, because I think that sometimes people don't appreciate that just because the families are not able to visit and we've eliminated all non-essential visitors to campus, we do still have physicians, physician's assistants, home health aides, people like that have to come in to provide care that our residents 100% need. So there is still some traffic through campus.
Yeah, that's exactly right. And this CEO from Lancaster, she said that her parents really didn't know anyone and were trying to socially isolate, but I think they might have still been driving some Amish persons around and going to the grocery store. So unless you are stepping into a bubble and not interacting with anyone, I would say it's basically impossible to protect yourself fully from this disease. So we do what we can.
So we have a question from Joan, and she's asking, she says, I'm concerned to know, do the staff have all of the equipment that they need in order to protect themselves from the virus?
Yeah, the question is, do they have all the equipment that they need? We have been working to get personal protective equipment, and we feel like right now, as of today, we have an adequate supply of most things. Just recently when we were fitting the N95 masks, and that's another interesting thing too, because people say, what do you mean fitting a mask? Well, you literally put a hood over your head and fit the mask on, and you put bitters in it to see if you can smell that or get a sensation of that through the mask. And if you can, that means there's leakage. Who would have thought a mask would take that amount of time to figure out, okay? We waited over a month, I think it was, to get our fit testing equipment for the N95 masks. So while we had masks and we were getting more and we feel okay about our supply at the moment, we couldn't use them because we didn't have the fit tester. Then some of the solution that came with it only was enough to do 40 masks. So we had to find that solution from Grandview Hospital, and they were kind enough to share with us. So that's the kind of thing that's happening, that you feel you have enough of the basics, and we always have enough of the basics just for the flu or other things. But the challenge is when everybody's buying, it's really difficult to find those things. And so I would say of the basics, yes, we have enough. And we've been acquiring cloth masks too. We have a lot of wonderful volunteers, both within the organization and the wider community. So we're trying to get to the place where we can provide those for residents and for staff who don't have direct interaction with residents on the COVID unit or the nursing unit or wherever. They can wear a cloth mask as well. So we're getting that up and running. But the reality is it continues to be a challenge, and we continue to work at that. But I would say, in answer to the question, the basic supplies, yes. but you always have those issues with the N95 fit test equipment and things like that that throw a wrinkle in that you're not always anticipating.
I've been listening on the news, of course, to all of the conversations that they have about N95 masks there, and I had no idea how complicated it actually is to get one that protects you. Not only what you were saying about the fit testing, but also the size. You have to make sure it's not too big or too small for your face. So when I'm in the grocery store and I see people wearing N95s, I now think to myself, I bet that's not really protecting you like you think it is. I'm pretty sure you didn't have that fit tested.
Yeah. Yeah, that's right. And the other interesting thing, Alex, is there's different brands. So you can't fit in one brand and then assume that's the case in the other. So when we're buying from manufacturers, we're not buying by brand. We're just fortunate to get any we can. And so what our purchasing people have done is looked at, well, this campus is going to get this brand. This campus gets this brand, because we don't want to be mixing and matching those things either. So there are some ways that we're finding that we can work at reusing them by cleaning them and sterilizing them. But that is something that we continue to work at. But it, on the news and the sound bites on Twitter, it all sounds so easy. I can assure you that it is far, far from easy. And it seems like even things that you think should be easy are not easy and are incredibly complex.
Another question that we have is from Gwen. And Gwen says, what can you do to further educate residents who don't seem to understand the concept of social distancing or physical distancing, as I hear we're supposed to be calling it now? She says, my mother tells me of residents who say, it won't hurt if my daughter comes to help me with my medication, or I'm not sick. What's the problem?
Yeah, it's a great question from the standpoint. It's a real question. This is real stuff. So if they were a 5-year-old, we'd say, take them out behind the woodshed, right? Or maybe that was like back 100 years ago. Today, you might get arrested, right? But the point is, there is a limit to what we can do other than to bring in the Souderton police and Chief Leary to start arresting people. So we encourage them. We try to remind them through videos like this. I know you say things on your videos that go on the campus TVs. We put it in writing. At the end of the day, some people may think they're invincible, or I feel fine, what does it matter? Well, so did 60% of the soldiers or the sailors on the Teddy Roosevelt. So the reality is we need to keep encouraging, but there is a limit as to what we can do. So I would encourage that same person to say, we're doing what we can do. You too encourage your mom or dad to encourage their neighbors. In addition to social distancing, let's use social peer pressure to work at each other to make that happen. And so it's not easy, but we keep reminding people. And I would say that's an illustration too of, I know just the other day we were having a conversation and there was a person saying, well, if this resident volunteer who hasn't been off the campus, they're safer than a staff person. Well, I would first of all say, well, how can you guarantee they weren't off the campus? Because our residential living residents still go to the doctor, they still go to the grocery store. Remember the story about the friend from Lancaster who may have gotten it at the grocery store? We don't know. So there is no such thing as being pure and not having exposure, unless you live in Antarctica, which I believe there were no cases a few weeks ago. Other than that, you have the potential of being exposed. And that's the thing we want to keep reminding people. This is not something that is a normal disease that we've seen. You really need to be careful and watch what you're doing. And just because you feel good does not mean that you're not a carrier.
Yeah. You said at the end of the video last week, you talked about the fact that this is going to be hard. And I think a lot of us would reflect that this was a hard week. We were trying, I think, almost more than anything else to make sure that we did everything we could to keep the virus out of our memory care units and our healthcare centers, which thankfully it's not in the healthcare centers. But our residents in the memory care centers are so vulnerable. So that's really where we did not want to get it. And of course we have at our Dock Woods campus. So it is hard. What would you tell us now that we're in this situation?
Well, I guess I would also say, and again, that it is hard. Let's not kid ourselves. Let's realize it's hard. We're not dealing with something like the common cold. We're dealing with something that is incredibly hard and difficult. And so we just need to give ourselves space for that, really. And also not blame ourselves. Our staff are really conscientious. I mean, they're really conscientious. They love our residents. This is not like a casual relationship. These are people they get connected with, and they love them and care for them. And so it's almost a stab in the heart when coronavirus came to town in Living Branches, and you feel guilt, and you feel sadness, and you feel grief. What could have I done more to work at that? And my wife told me the other night, she was reading something and it said, what you need to rest in is that you did all that you could. You did the best you could. And now you need to deal with what's coming out of that. And so in some ways, at times, our staff will need to forgive themselves, to say, I am not responsible for this. We did the best that we could. And now we need to do the best we can in this new situation. And I remember too, on March 11, got an email from my brother-in-law, and he's a pastor in Indiana. And in it, he talked about someone in their congregation giving some advice. And they were talking about how bad this could get. And even in the email, I would quote from them, they said, this is going to get much worse in April and May. Much worse. Okay, I'm reading that March 11, and you get this pain in your stomach saying, wow, what does that mean? I had no idea, March 11, what that would mean here at April 17. And I still don't know what it means compared to some other places, and we don't know where it's going for us. But we need to do the best we can and forgive ourselves, but continue to do the best we can with what we have and what knowledge we have. So that's very, very important. A company that we use, Venture International, to help with communication strategy and things like that, very good organization and has been very useful to us over the years. They put out a paper on the road to resilience. And I think I may talk about these over the next 2 weeks. There's 3 sections to this, and we're using with our staff members, our team members as well. But the 3 parts are calm yourself, change your thinking, and create a resilient lifestyle. And today I'd like to just briefly talk about calming yourself. They talk about deep breathing exercises, physical exercise, journaling, writing down what you're feeling and thinking, spending time outdoors, and the hard one, limit phone usage. And I would say I am completely guilty of that. I'm reading articles too late at night, articles that aren't always the most uplifting because it's telling you what's going on. And anyway, that was one of the things they talked about too, limiting phone usage. But thinking about deep breathing, just for a moment. I know we talked about it in CRT and how are we taking care of ourselves. And I think we realized pretty early on that We can't just say we're going to cut this off at 9 o'clock at night because there might be an email at 10 o'clock that needs to be responded to, or on the weekends. So to think that we're going to kind of have vacation time during this time is out the window, obviously, or even less time at work. But you can still do those things during work days or whatever, to just take a moment to breathe and to take in a deep breath. My wife and I have been doing yoga for the last little while, and that is just helpful to just take some time to breathe and take time to do that. Certainly physical exercise, journaling. One of the things it says here, write down your negative thoughts and let that be the way to clear your mind. Put it on paper, let it go, be gone, put it behind you. Spending time outdoors, it's important to do that with appropriate distance, of course, but it's important to do that, and we've had some nice days too in the last week or so. And then, as I said, limit phone usage. And I would say it says here, high mobile phone use is associated with stress and sleep disturbances. And I think that would be a true thing, whether it's coronavirus pandemic or not, that cell phone use and other things like that can really be a challenge and a stressful thing to us.
That would certainly be true in our family. There is a correlation. Well, thank you. This has been informative, and it's nice to get to talk to you without a mask on for a while. So even though we are very far apart.
Yes.
Thank you for watching. We will do this again next week. So please remember, if you have questions, you can send them to us at coronavirusquestions@livingbranches.org. Also, visit our website, livingbranches.org/coronavirus, for the most up-to-date information on the situation at Living Branches. Thank you.